So this is also one of the important the protocol, we can say as a. So this is used to manage the chronic disease and all this. Okay. So when you talk about the chronic disease, so we need to have the continuous monitoring. So when you have the continuous monitoring, so we will be looking about the patient's conditions and all those things, right? So for that, this telecare is one of the useful method, we can say. So this telecare is used to connect with the remote locations and all those things. So this also can be used to enhance the delivery of healthcare services to the patients. Okay, so this can be done with from their homes, so that can be done. Then when you want to have this kind of telecare protocols and other things, so we'll be using the kind of set of supportive electronics and different sensors can be taken. Then we'll be looking about the kind of alarm methods and other things whenever the threshold crosses and other things. So we will be using the communication mediums. So why this role is we are taking into the system, because we want the people to be live independently. Okay, so the monitoring, continuous monitoring will be there, so they can do their work so without any the struggle. So that is the meaning of this tool we can use. So when you talk about the telecare, so it can be used for some kind of emergency situations and all those things, like for example, the fall, fire, flood. This during this time also we can use. Sometimes we can use for the this regular activities also for monitoring the lifestyles changes and all those things. Because say example, when you're talking about the particular disease, so the disease management is very very important. So when you talk about the disease management, so you will be requiring the data. So the continuous data should be there with the time frame. So you will be requiring the continuous data. So with that, so we can check that over the period of time whether the lifestyle is changed or all those things. So that is very very important. So similarly, the telecare is not intended to replace the human contact. So because we can't say example the caretaker is there, means the equivalent to caretaker the telecare will not do, but still we need to give kind of support to the patients. So whenever they are required, so they can be used with that. So like that, the telecare is built. So this is the entire the telecare block diagram. So we'll be looking about the different aspects. So we'll be using all the communications mediums. So then we will be using the monitoring of personal things, science, personal things in the sense for physiological signals. So that will be taking care of the daily activities. Okay. Then we will be bringing with some kind of assistive technologies. So this also can be used for them to help the people. So kind of the door opening and crossing the particular the area and other things that can be taken with it. Okay, so the control of beds and other things. Okay, so this is very very important. So when you talk about that, so we'll be using kind of communications. Then we'll be monitoring with their physiological signs and all those things. So the physiological signals are very very important. Then we used to have some kind of assistive devices, so supportive things. Then safety and security monitoring. So this is also all will come together as a tool, so which is given to their comfortable location. So that means in their home itself, so that can be monitored. So this can take the preventions, mitigating risk, and it can improve the functionality as well as it can use for the prevention. So this all together, when you are building a very good telecare systems, this will give you as a benefit to the patients. So that's very important when you look for this one. So when you look for the assistive technology, so there are a lot of assistive technologies there. So when you talk about assistive technology, so the device which you are going to use, so that is going to give kind of support to the patients, or support to the people to do their daily activities and all those things. Okay, so the simple example we can say a smart walker. Okay, so that will give you kind of assistive to the people. So if they are facing any problem to walk from one location to the one room to the another, so the smart assistive walker, so that itself, it's, we can say as a assistive technology. So because you are enabling the people to walk from one location to another location. Similarly, that can be extended kind of the special equipments. So the box seats, wheelchairs, stair lifts. So this all will come into the assistive technology. Okay, so we have like the security and the safety of the home also. It comes in the kind of assistive technology when you are building with the different security levels and all those things. Okay, so the lifestyle reassurance. Very important thing is the checking out of the vital signs in the remote locations. So this also, it's we can say as an assistive technology. Okay, so in this we have some kind of the standalone devices. So this standalone device, when you talk about the real-time device, standalone device, so this standalone device, so this is which is not going to get any kind of feedback. The feedback in the sense kind of alarm, any kind of alert. Okay, so only it will check. Okay, so whatever the based on the the usage, so it will give kind of information. So that's all. Okay, so it is not going to give any kind of the alarm kind of thing. Okay, so the alert should not be will not be given. So that means there is no feedback loop kind of thing. Okay, if the feedback is there means, so say example, the glucose level you are monitoring. So the glucose level, if just you are observing, okay, 200, 250, 300 like that. Okay, so if this standalone device which is going to connect with the through the internet connectivity, it's going to feed all your informations into the cloud, then you, if you are returning back anything, or if you have any kind of threshold level, if you are crossing the threshold level, or if you are less than the threshold level, if you are getting some kind of SMS or something, then it's not a standalone device. Here the standalone device, it's used by the person. So whatever the information is seen, so it's with the only with the instruments. Okay, but if you're taking any kind of alarm, then it's not a standard device. Okay, so here there is no alarm kind of thing. It's happening here. Okay, so similarly, you need to understand the telecare. So the telecare is a totally different from the standalone device. So that's what I am trying to say here. So the telecare, it's whatever the vital signs, say example, the glucose level you are taking. So getting the glucose level from the instruments, the equipment, immediately it will send all signals, all the data to the server center. Okay, so it will reach to the server, the cloud. Then from there, say example, you are the patient is in home. The patient is monitoring the glucose level. Immediately, it will reach to the nodal centers. Okay, from the nodal centers, immediately you are getting as a kind of monitoring alert. Something you are crossing your crossed your threshold level. So it's a very high blood sugar level, it's a very low blood sugar level, take this kind of medications, immediately you do this. So this kind of assistance calls if you are getting, that is nothing but a telecare. Okay, so you need to understand here So the standalone device only the monitoring purpose, only for the vital sign checking purpose. But when you look for the telecare, so all the signals can be fetched to the nodal centers. Then from the nodal centers, you will be getting the call assistance. So if you are getting call assistance, that is nothing but the telecare. So immediate response will be there from that end. Okay, you understand what I'm trying to say? So for this example, we can say as a fall detector, a door exit monitors, all those things we can say as an example. So now we'll be looking about the different perspectives. So like a telecare will come with like a kind of with the assistive technologies. So we studied about the telemedicine, telehealth. So this all will comes into the different categorizations. So this all can be used for the different purpose. Okay, so starting from the environmental controls, lifestyle monitoring, proactive callings, social alarms, lot of things, vital sign monitoring. So one of the important thing is vital sign monitoring. So this all will be connected. The say example nowadays it's a reminders also, patient reminders. So if the patient is in the home care monitoring also can be done. So this all will comes when the patient is admitted into the patient inpatient. So when they are discharged from the hospital, so it can give supported discharge also. So after that, the post discharge they can monitor through this tool, right? So this all we are bringing to the patient comfort level. So very important thing is you need to understand. So we are almost covering the entire the comfort zone of the patients. So because when you are reaching the comfort zone of the patients, the patient recovery time is very less. So it will be sooner they will get recovered from this absence. Okay, so that is very important. So we'll discuss about the how the patient is cooperating for the this kind of teleservices. If sometimes we any advanced technology will be having kind of disadvantages also. So that we'll discuss in the later stage. Okay. So this is the telecare systems. Already I told you. So you'll be getting as a the tool that so which is going to connect with the monitoring centers. So here the wireless sensors networks which is created here, which is going to have the different sensors units. Okay, so the different sensors units we have here. So this or we can say as a different devices. So the different equipments which is connected in the comfortable zone of in home patient home. Okay, so which is going to be connected with the hub, which is through the hub in home, which is going to connect to the monitoring centers. So say example, every day morning we have to check the pulse of the patients. So they have to check the SpO2 level of the patients. So they have to check the glucose level of the patients. So whatever the data which is achieved from that sophisticated device will be through the wireless sensors. This all will be the wireless sensors which is going to fetch to the hub. Okay, through the hub we will be connecting with the monitoring centers. This monitoring centers will be collecting like this several patient informations. Okay, so the say example 20 diabetic patients are there. So the 20 diabetic patients will be into the one portal. Okay, so all the 20 patients, all the data will be taken into that consideration. So this all 20 day patient data will be collected into the monitoring centers from the different home hub. Okay, so this different home hub will be given as a different ID and other thing with the patient ID or something. So through that, so we'll be getting all the informations to them. So once if we get all the information, we'll be checking that so which patient threshold is crossing, whether they're on the normal conditions. If any reading vital signs are in the abnormal conditions, immediately the response team will be connecting to the patients immediately to get the basic medications and all those things, so they can give the response to the patients immediately to get out of this. Okay, so when you think about this, so the always you need to understand, now you can compare with the telecare systems, how efficiently, effectively, which is going to give the comfort zone to the patients. That is very, very important. So for this, you will be requiring the communication networks, so network connectivity and all those things. So here we have like wireless sensors. So imagine the patient in the remote locations. So how the internet connectivity and all those things. So, but they can think about the kind of possibilities, how they can keep with the connected with the monitoring centers and everything. So that all will come in to see in the module 2. So how, what kind of networks and other things they will be using. Okay, so then this is emergency response teams. So with this emergency response teams, you can check that different services can be taken care. Okay, so this is a telecare control centers we have here. So this telecare control centers, which is going to have the different services. Okay, so when they have them any emergency, starting from the mobile warden, the social workers, say just connect with the mobile warden, then the duty of social workers. So we'll be connecting with that 24 hours nurse, then 24 hours gas fitter, then the emergency plumber, everywhere. It's not something the telecare is only for the morning, only for the healthcare conditions. So it can be connected with everywhere. Okay, so this very, very important. So you can look about the fire services, ambulance services. So everywhere it can be taken. Okay, so this is this all will be come to the picture as a emergency response teams. So this emergency response teams very, very important. Okay, because whenever this situation arises, so immediately who is going to respond to the people, that is very, very important. Okay, so it is connected with the different and what is that, different nodes we can say. So information will be shared immediately with them, okay, from the so when you talk about the telecare systems, so we need to know about the exact characteristics of that. So it is not appropriate for every person. So definitely will for dedicated functions it will be working. So this is not something like a one size fits all. So solutions. So no, not at all. So it is purely based on the needs. Okay, so how this particular person is need based, we can say. Okay, so it can work, this telecare systems, when you are implementing the systems, it works very effectively. So when it's working with the effective sense, so it can promote the independency and the safety levels. Because say example, you are connecting with the fault detectors. Okay, so the fault detector will give you the kind of elderly people. You are designing a fault detector which is going to connect with which is going to use by the elderly people. So the safety, immediately the response will be getting, so the immediately the alert will be getting, so like that. So the safety of the systems, it can work with the independency also. So it can have the kind of the robust response infrastructures and all those things. So we need to know about the what is existing methods we are using. So that has to be taken. So when you are considering the existing methods, then you will be integrating this with that. So you will be providing the efficient solutions, efficient methods, the processing of the things. Then you can hear the very effective services. Okay, so this also can be used for the telecare as well as uh, the purpose of health as well as social care provisions. So definitely we need to think about the ethical issues. Any tele services point of view. So we'll be looking over the ethical issues. Okay, so this related to the ethical issues we'll be looking in the next class in the detailed way. So ethical issues are very very important when you are performing the any teleservices. So the telecare services integrations. So say example, when the patient is entering in care, so we can have the entry level. So they are looking for the assessment of need. Sometimes they will be coming again for the reassessment. Okay. So when they have the assessment, so we'll be providing the lot of the services to them. So when they are look for this, so like starting from the social services, telecare services, primary care, acute care, sometimes no, the acute care, housing services, suppliers, different equipment suppliers, landlords, social housing landlords, and all this. So this all comprises. So this will give you kind of when they are coming for the assessment or the reassessment. So they'll give you entire thing, kind of the care package development starting from that. So we'll be having the prescriptions and the protocols, how we need to follow and all the things. This can be done for the home survey. This can be done for the monitoring purpose. This can be done for the response review. Review once if it is coming again, it can be taken for the further things. So to monitor as well as to review that, then it will be corrected with that. Okay, so this lot of process can be taken with that. So the integration is very very important. So why use we use the telecare? So when you look for the telecare, so it's kind of confident that it's going to give the kind of provisions for the people. Okay, so the solutions to the people. So example is we can say as a the older people can live independently. So when they have the when they are living independently, it's going to give kind of the secured level of life, day to day activities. So in that when they are living with that, so it's in the control with the dignity for the longer period, we can say. Okay, so we need to have, so say example, nobody is there to take care of the elderly people. So this kind of service, the telecare service can help them to not to feel bad. So they can have through the assistive devices and all those things, assistive technology, so they can live independently. That is the ultimate aim. This is not only for the elderly people. This can be used for the several segments, we can say. So the several people can be benefited with that. The detailed way we can see it. Okay. So how we can telecare be used? So when you use this condition environment, so you just see the different conditions we have. So starting from the small things which we use in the home or any offices. So smoke detector, gas CO detectors, okay, temperature detectors, extreme temperature detector. So this all comes into the environment conditions, pop-up plugs and all those things. So this all will give you flood detectors and all. So this is going to give the immediate informations to the response teams, control centers. Then immediately you will be getting response from them. So you just in terms of environment, in terms of security level, so you can have the different the security level. You can have like who is entering to the door, who is you can have kind of controlled audio, controlled video. So you can, through the video in a system only, they can get the access to enter the home and all those things. So everything can be taken methods. Okay, so this is security level. So you can keep nowadays everywhere the biometric systems are coming. So to have, so this is so any unusual things are happening immediately. It can give the information to the control monitoring centers and all this. Similarly, the safety of the people. So already I told you like a fault detector. So when you talk about the fault detector, so it can be used for the elderly people and other things. So and then uh, bed and chair occupancy sensors. So the sensors will give you kind of information. So how many seats are occupied? Say example, when you have the ICU beds and all those things. So we can get the data that how many beds are occupied. So if you are having the kind of sensors and all those things, so automatically it will fetch the data. So the patient out of 10 ICU beds, so 8 patients are available, 2 beds are vacant like that. So now in this pandemic, you can check that in the government portal. So they have like a COVID-19 availability of the beds in the hospitals. So this is also kind of information. So that is needed. So similarly, you have the lot of safety measures. Okay, so uh, the GPS tracker and the locators and all those things. Okay, so this is also used for the several cases and all those things. Okay, so then the social, so the telecare we will be giving for them the 24/7. So if you are looking for the 24/7 monitoring, okay, this is going to give the kind of benefits to the patients as well as elderly people, so we can say. So the number of visits can be reduced. Okay, so this is very important. So whenever they are in the telecare process, so say example every month they need to visit hospital, so that can be reduced through the telecare systems. So this can be whenever the emergency situation occurs, they will be reaching to the hospital. So otherwise they can get the medications and all those things through the telecare system. So they will be from the monitoring centers, they will be interacting with them. So that is very important. So sometimes we need to know about the how this interaction is taking place and other things. We need to consider volunteers to visit at home or integrate into the community activities and other things. Okay, so this can be taken. So very important thing is how this can be taken with that. How we are going to enable the meaningful social interactions. So we need to develop a kind of interactive systems. So that can be achieved through the set-top box. What do you mean by set-top box? So we know that everywhere in every home we have the DTH system. So the DTH system is a direct to home. That for the television purpose we are using, right? That is nothing but a set-top box. So this set-top box can be used. This kind of methods can be used to provide the particular region. So this all information will be provided to the local services. Okay, so this from the local services they will be connecting to the whatever the needy persons. So they will be looking for the kind of health advisors and all those things. Okay. So this is very important when you look for the this kind of process. So this particular region, for example, when you're taking as the one particular village, which is going to have the every home they have a set of boxes. So which is for the healthcare services, which is going to connect to the primary health centers. So then it will be good, right? So you need to understand how we are connecting with the people. So that's required for the